afternoon, everyone. My name is moderating the launch meeting of the Rare Disease Diversity Coalition, which is focused on the critical issue of addressing disparities in the rare disease community. We've got a robust program full of inspiring speakers for you today. I'd like to begin by asking Linda Goler-Blount, the president and CEO of the Black Women's Health Imperative, who founded this coalition, to provide a warm welcome and share some initial thoughts about the mission and the work of this coalition. Linda?
Thank you, Leslie. Good afternoon. Thank you for moderating today's program, and welcome to all of you. Thank you for joining us at this inaugural meeting of the Full Rare Disease Diversity Coalition. For the first time, we're meeting together as a group of patients, steering committee members, new coalition organizations, and a broad range of friends, experts, and advocates, all committed to the work of health equity and justice. International Rare Disease Day is February 28th. So this is a great opportunity to honor those in the fight for cures and equity and to talk about the work of the RDDC. We have a number of very special guests today, and I want to extend a warm welcome to them all, starting with a special message from Congressman G.K. Butterfield from North Carolina's 1st Congressional District and co-chair of the Rare Disease Congressional Caucus, who serves as a true champion for expanding access to quality care and eliminating inequalities and racial disparities in health and healthcare. Senator Tim Scott will be represented by Connor Sheehy, his Deputy Legislative Director. And we're incredibly grateful to have someone from the Biden administration who took time out of her schedule to record a message just for us, Dr. Marcela Nunez-Smith, who spearheads progress in combating healthcare disparities as chair of the Biden administration's COVID-19 Health Equity Task Force. And last, but certainly not least, we have a special treat. The 15-year NBA veteran, 2006 Miami Heat champion, 7-time All-Star, and member of the Naismith Memorial Basketball Hall of Fame, Mr. Alonzo Mourning, who will join us and share his experiences and valuable perspectives as a patient living with a rare disease. We certainly have a robust and inspirational agenda in store for you today. So last May, the Black Women's Health Imperative convened its first-of-a-kind coalition to address the extraordinary challenges faced by people of color living with rare diseases. We announced the coalition during the height of what has often been termed the triple pandemic, the COVID-19 pandemic itself, and the pandemics of widespread economic inequality and racial injustice. In some respects, the timing couldn't have been better. I can't tell you last year how many people said, I had no idea health disparities were a thing, or I had no idea racism was a thing, or I had no idea they were related. We know for Black and Brown people, it can take sometimes more than 7 years to get a diagnosis. Often there's a lack of information. Sometimes their providers simply don't ask important questions. They make assumptions about what they will and will not do and don't refer them to specialists. And for those who would participate in clinical trials, the process from the trial location to costly time requirements, time away from work, childcare, to the laborious informed consent form makes it nearly impossible for all but the well-resourced and well-connected to participate and have a chance at an effective therapeutic or cure. We began to address these problems last year with the launch of the Rare Disease Diversity Coalition. I've been asked over years by many pharmaceutical companies for clinical trials participants, and my answer was always no, because I wanted to talk about why they were reaching out to me, why they were having so much trouble recruiting Black and Brown patients for their clinical trials. And no one took me up on that offer because they were afraid of having to address historical racism and gender discrimination. They were afraid to have to talk about discrimination in medicine. They didn't want to talk about Tuskegee or Henrietta Lacks or J. Marion Sims. Then I met Eric Dubé. He understood the challenges those who would be overlooked faced and had the courage to engage in difficult conversations. He brought Travere to support this effort and then brought others to the coalition to follow his lead. Those on the RDDC and frankly, patients living with rare disease are a fearless group. Thank you, Eric. I'm personally thankful to have the support and input from patients, health experts, and community leaders of the RDDC who work to identify the most pressing challenges people of color living with a rare disease face and develop actionable recommendations to solve them. Today, you'll get a snapshot of those recommendations, which we will begin implementing this year. This action plan is also included in the Coalition's new report, Charting the Path Forward for Equity in Rare Diseases, which we released today. There's an opportunity to make significant progress in addressing health disparities this year. The road will be long and the challenge is great, but my colleagues and I in the Rare Disease Diversity Coalition are ready to roll up our sleeves and meet those challenges. We look forward to partnering with all of you in the year ahead. Toward the end of the program, we'll share more information about how you can get involved, but for those of you who may not be able to stay with us for the entire time, you can learn more about us, including our recommendations and learning about how to get involved at rarediseasediversity.org. And with that, let's get the program on its way. Thank you again for joining us. Leslie?
All right, Linda, let's keep this going. We got an exciting program for sure. I'd like to first recognize our RDDC steering committee members for their dedication and support of this coalition. Of course, we would not be here without your continued commitment to combating racial disparities in rare disease. So our steering committee members include Beverly Francis Gibson of the Sickle Cell Disease Association of America, Amy Hinojosa from Mana National, Elena Rios with the National Hispanic Medical Association, Reverend Matthew L. Watley, Senior Pastor, Kingdom Fellowship AME Church, Juliette Choi with the Asian and Pacific Islander American Health Forum, Tamar Thompson, Alexian Pharmaceuticals Incorporated, Yusra Yusuf with the South Asian Public Health Association, Brian Thompson with the Association of American Indian Physicians, Shanta Chambers, Patient Advocate Foundation, Ashley John, Biotechnology Innovation Organization, Courtney Pichinsky Keplinger with Vertex Pharmaceuticals, Reverend Anthony Brownlow with Alfred Street Baptist Church, Cassandra Maculo with the Association of Black Cardiologists, Christian Rubio with Global Genes, Kimberly Hogstad with Action Partners, Garfield Clooney with the National Medical Association, Aletha I should say, Maybank with the American Medical Association, Saira Sultan with PCORI Advisory Panel on Rare Disease, Pamela Price, Balm in Gilead, John Burns, Burns Brothers, Kim Smith Whitley, Children's Hospital of Philadelphia, Marshall Summer, Children's National Hospital, Laura Widener, Epilepsy Foundation of America, Julia Jenkins, Every Life Foundation, Donna Cryer, Global Liver Institute, C. Grace Whiting, National Alliance for Caregiving, Millicent Gorham, National Black Nurses Association, Lauren Lee with NephCure, Debbie Drell with NORD, Eric Dubé with Travere Therapeutics, and Eve Dreyer with Travere Therapeutics, and rounding it out, Tammy Boyd with the Black Women's Health Imperative, and of course, Linda Goler-Blount with the Black Women's Health Imperative. That's a mouthful. Let's start there. And it's great to keep this going. Of course, patients and patient experiences are really at the core of what the Rare Disease Diversity Coalition is all about. And so for our next segment, I'm really delighted and inspired to introduce a panel comprised of 3 patients and patient caregivers who will share their personal insights and experiences with rare diseases. We have Kevin Mott, who is a rare disease patient, a rare kidney disease patient, I might add. We have Stacy Y. Brayboy, who is a patient in search of a diagnosis after years. And we have Elisa Callejas, who is a caregiver of a rare patient. Thank you all for being here today. And this is a really important conversation to have, particularly for those who are not familiar with the journey of someone who is navigating a rare disease. And so, Stacy, you're a rare disease patient. You serve as director of the Virginia Office of Intergovernmental Affairs in the Office of the Virginia Governor, Ralph Northam, and your disease remains undiagnosed, even with all of the access to people, places, things, information. You've been involved with the Rare Disease Coalition's working groups as a guest participant, and you have helped to inform the RDDC's recommendations. Kevin Mott has a rare kidney disease. It's FSGS. It affects the kidney, and Kevin is an advocate, I should say, for rare disease patients. In addition to working as a financial advisor, Kevin also serves as a board member for something called NephCure Kidney International. And then rounding out this panel is Elisa Callejas. She's the director of community outreach for the Akari Foundation. Elisa focuses on education and community outreach in the Hispanic community for families affected by Duchenne muscular dystrophy, a cause that she is passionate about after her nephew was diagnosed some 5 years ago. And so today she uses her passion and her motivation to expand the Akari Foundation's mission. So welcome to all of you. Thank you for being here to share your stories with all of us. Stacey, I guess we'll start with you because you know this journey firsthand, how difficult it can be to arrive at a diagnosis. Can you talk a little bit about the experience that you've had and the barriers that you've faced?
Sure, Leslie. So my journey has been one that is still continuing. As you've shared, I am still in search of having a true diagnosis for what I have been dealing with for over the last I would say going into 2 years. Initially, it was, even as you've stated, having resources, being able to have insurance, walking into the doors, being able to first my journey began with me breaking out with an infection over my fingers, little bumps, little hives, wasn't exactly sure what it was. And then I went in for treatment for something else. And one of the healthcare professionals said to me, have you had anyone take a look to see if you have some type of autoimmune issue? And of course, that was something I had never heard of, had never thought of. And to kind of share a little bit with everyone who's joined us, it becomes very difficult when you go in and your first diagnosis, when people look at you as a female, over a certain age. If you're a little healthy as I am, a little bit overweight, they put you into first categories of saying, oh, well, maybe it's high blood pressure, or maybe it's diabetes, or maybe it's some other element that we naturally comes to the beginning of the forefront of physicians or someone in the health profession's mind when they first see you. And so not until I decided to become my own advocate, to start to look for organizations like the Black Women Health Imperative. And that's why I think this organization itself, in terms of bringing us all together, being able to give us a resource, or being able to ask the questions for someone to help you be able to advocate on your behalf will help you. What I will tell you, my experience was, first, when they were trying to rule out several things, it wasn't until one person said, let's bring all of these different symptoms together. It started out with me having a stress fracture. It started out with my fingers becoming extremely swollen, painful when I would wake up, until the pain started radiating throughout my body. I still have to wear a wrist brace because my wrists are extremely painful. And with me having a little person not being able to lift, not being able to play, what I will be able to play with them. And what I will share with you, why all of this work is very important that we're doing, and connecting people and letting people like me, but also people who are not like me, know that there are ways to get resources, to be able to identify how you get help, and that most important, putting policies in place that help you become an advocate for yourself. I started asking questions. Can we test for this? I started looking on websites, trying to diagnose myself. And of course, I don't have a medical degree, but I was able to line up the questions and make a reference so that when I went in to see the specialist, I could say, can we check for this? Can we look at this? And what I'll tell you, Ms. Foster, that allowed me to be able to get us to move a little bit further down the track. I'm still waiting for us to figure out or find out to be diagnosed so that we can continue to get treatments. Right now, I am on a high potent steroid. And as we all know, you can't continue to take a steroid because the steroid addresses the issues. And as we all know, you can't continue to take a steroid because the steroid addresses the issues. I'm able to move, there's not as much pain. But as we all know, you can't continue to take a steroid past 6-7 months, because we've got to be able to find out what the issue is so that we can effectively treat it.
What is it like, Stacey? You've described these symptoms that you've had. I mean, you've got a high stress job. I'm sure you work a lot of hours. You're like, okay, this has got to be something work related. But as I hear you describe all these symptoms and you talk about having a little person that it's hard to engage with, how do you put into words what it's like to be navigating this journey without a clear diagnosis and with symptoms that are continuing and no real answers just yet?
I will tell you that it's extremely stressful. You're right. Having a demanding job initially, the first check, again, as I kind of share with you, is they immediately equate it to the fact, well, maybe you're under stress. And that's what's leading to the breakouts, or that's what's leading to you not being able to rest, or the pain that you're feeling. So I'll tell you, dealing with a job that I love, which is a high demanding job, there are some challenges in regards to how do you manage it all, because that adds another a layer of stress when you don't know what you have, and when you have these flare-ups again and you can't get the answer and you can't get the treatments, and you've got to change the medicine several times because they can't quite figure out what it is. So you smile and you smile and you keep going through with it, but it does add another layer of stress to everything that you're doing.
It sounds like you wish that people like you who have some sort of rare disease had additional resources and support.
Yes, 100%.
100%. Kevin, I hear a little bit about what you may talk about in what Stacey shared, which is one of the things you've advocated as a rare disease patient is this need to advocate for yourself. And Stacey talked a little bit about doing her own research, lining up questions. But I wonder if there's some other things that you think rare disease patients of color need to be deliberate about in their advocacy.
Yeah, and thank you for asking. And I definitely can relate to some of the feelings that Stacey has. I think one of the first things that people of color who are dealing with rare diseases are just, health issues that seem to be a little bit more difficult to deal with is just one, having the understanding that you have a right to expect to have a relationship with your healthcare providers, a relationship where you should be able to ask whatever questions you want, talk about anything that you want, be open and honest about what's important to you. I definitely relate to Stacey and talking about all the different medications that you're taking and things like that. And, I was very fortunate when it took me a while to find the right nephrologist. But when I did, we could talk about, okay, if you give me this drug, this is the side effect that is going to come. And I don't know that I can do my job if I'm dealing with that side effect. So can we try something else first? Especially since, when you, at least in terms of FSGS, we're not at a point where we can tell you what the 10-step plan is to solve this. A lot of it is kind of guesswork along the way. I used to joke that I felt like we were playing medicinal roulette at times with the different drugs that you're on. But, just understanding as a patient, you are not wrong to say, okay, before we try that, because we have this side effect, and this side effect will make it so that I can't do the things that I would like for us to try something else first. So what else can we try, or what can we talk through? And, I think that builds a lot of trust between the patient and the doctor. And that's really important. And one of the things that I have really appreciated in the volunteering that I've done with NephCure is I've had opportunities to talk to doctors. And one of the things that I stress to them is that when you are dealing with someone who has a condition where you can't tell me the 10-step plan, you are going to tell me something that is wrong. You are going to give me something that does not work for me. And for me to say, okay, that didn't work, let's try the next thing, means I have to trust you, and you have to build that up. So I think on the patient side and on the physician side, the communication is where advocating for a relationship where you are heard, and advocating for a relationship where you are willing to extend trust to your healthcare professionals and say, okay, if this doesn't work, it's not the end of the, it's not the end of the world. We will move on to the next thing. But we are doing that, understanding that, I'm a person, I have, what the things that are important to me, and I want you to think about that in my treatment.
So you're talking about advocacy, the advocacy that you, Kevin Mott, can do. But what
Right.
about organizations like RDDC? What can this organization do, you think, to really lessen the burden on patients like you when it comes to ensuring that there's health equity in the diagnosis process, in the treatment process, in these conversations that you're having about what's best for you?
I think the most important things that organizations like this can do is talk to doctors about their bias, potential bias, any underlying bias that they might have with the patient, and emphasizing to them that it is also their job to do what they can to build trust. So getting doctors to recognize that there has been bias, they might have some bias that might affect the patient, and talking to them about how that might affect a patient's compliance, how that might affect the patient's ability and willingness to stick to a treatment plan, and just making them understand that it's not just your knowledge, it's not just what you prescribe, it's the relationship that you build with the patient. It's a two-way street.
I hear your journey, I hear Stacy's journey, and I wonder, for folks who may be on this journey, it seems like it can be pretty isolating and lonely. And so if you're going through this and trying to get answers, and you are a person of color and you feel like the physicians aren't listening to you, what advice would you have?
Fire the doctor. As much as your healthcare, and this is definitely a big part of the issue. If you don't have higher enough quality of or access to healthcare, that can be a problem. But if you do have access to healthcare that at least gives you the option of firing that doctor and going to see another doctor, you have that right, and you are not wrong to do that. I had a kidney transplant in 2017. And some of the drugs that they give you, sometimes they can affect your blood pressure. And, I was having issues with blood pressure, and my doctors had recommended that I go see someone who was considered an expert at it. And when we met, I don't think he asked me 3 questions about me. He came in and he told me, it's this, this, and this. And I know he's one thing he said in particular. He said, okay, I'm going to want you to start doing things like reading the back of cans to understand the ingredients. I am one of those people who is like at the farmer's market, first thing every Saturday morning, buying the organic, non-GMO, healthiest thing I can. He did not need, there was no way or no reason for him to make that comment to me. But he had not talked to me at all about my lifestyle, my diet, my attitudes, my habits, anything like that. And I went back to one of my other doctors who had referred this person. I said, I just did not like our interactions at all. Unless you tell me that there is a very good reason why I should continue to see this person, I don't want to see this doctor again. So you have the right to look for doctors who will treat you the way you want to be treated and help you develop the relationship you want to. I just don't want a doctor who doesn't ask me questions about me.
And you took the power back in that situation, clearly. And it sounds like that's what patients who are going through this journey have to do. When you feel like you've lost so much control, you at least have hopefully some control over that part of the journey. Elisa, I know that you are navigating this new world because of your nephew who was diagnosed 5 years ago. And you have spoken to members of RDDC about the unique challenges facing the Latinx community in terms of getting a rare disease diagnosis. Can you talk a little bit more about that?
Sure, and thank you for having me. It's a pleasure to be the voice of my community. Yeah, like you heard Stacy and Kevin. They're both mentioned two important points. One is advocate, and another one is building relationship with your doctor. So how do you do that when there is a language barrier, right? Unfortunately, the Latino community, we face this intersectionality of different problems. One is the language barriers, immigration status. So when our families come to see the doctor and they don't speak the language, how are you going to advocate for your kids? How are you going to advocate for yourself? And that's kind of like what happened with us. I mean, in our case, with my nephew, it was a little different because he is one of the lucky kids that was diagnosed when he was only 2 with Duchenne muscular dystrophy. However, that's not the case for all the Hispanic families. The average age for the kids to be diagnosed is 9 years old. So that it's because the families keep going to the doctors. The doctors are not really listening to the parents. And our community are, the type of families that will trust the doctor. So we think that the doctor has the best interest on us. So if the doctors is not really going to ask for more information or ask for more tests, then we're okay with that. And so many years can go by without like kids being diagnosed. And those years are very important, especially for kids with Duchenne muscular dystrophy, because at age 5, they can start treatment. So if you are barely getting in your journey at age 7 with your kid, so you're already missing out on a lot of information and a lot of treatment and possibly a lot of clinical trials that have gone by where you could have your kids being part of those clinical trials.
It sounds like what, in addition to the advocacy on the point of the family, that really a patient navigator, somebody who could help with that cultural competency, with the language barrier, and help you navigate that might be something that's really beneficial.
Exactly. And that is something that we don't get offered when we go to the doctor. Just to give an example, when we got our nephew diagnosed, we were given this like about 3 sheet of paper and like, this is the condition of your nephew. And one of the things that it says, he's going to possibly be dying at the age of 18. How do you think that we take that? I started doing research and finding information. And how am I going to tell my family now that my nephew is probably going to die at the age of 18? And am I going to have to print information out? There's no information in Spanish. And that is the reason why I joined the Akari Foundation, because we realized, along with the founder, that there is a lot of information that is missing with Duchenne, and that's only one of the rare diseases that I'm discussing. However, I come across Hispanic families that have been, some of them haven't been diagnosed until mid-30s with different diseases, and they don't find that information. So how do you get more information? You're not getting enough information from your doctors, and you're not getting enough information online. So it's very difficult for the Hispanic families to navigate rare diseases.
How is your nephew doing, and what is his life like now?
My nephew, he is going to be turning 7 and pretty soon. So he got diagnosed 5 years ago, and every day is different. Like the way that he was diagnosed is because they were looking to see if he was going to have autism. So he, in addition to the rare disease, he also has severe autism. So in the search for autism, that's how they found that he had Duchenne. So if it wasn't for the fact that he had signs of autism, we probably at this age, who knows, we probably wouldn't know. So we saw a lot of signs early on, like by month 3, the mom started noticing things. Doctors keep saying everything is normal. It's a normal development. But to answer your question, my nephew is doing good right now. He's on medication. We have tried to put him in a clinical trial, which it hasn't been any success. And, like I'm learning as I go too. I keep doing more research for my nephew, and whatever information I find, bring it to the Akari Foundation, put a webinar. I reach out to families and find out what they need, and the need is so huge that it's a lot of work. It's a lot of work for the community. So basically, we have taken on it's our own task as a Akari Foundation to try to bring doctors to educate the families and for them to know what's next, because we don't know. We're learning as we're going. And so far, my nephew is walking, thank God. And like I said, he's on medication. We don't know how much more time he's gonna be able to walk at the speed that he's walking right now. Just being patient right now and try to find as many answers as possible.
It is quite the journey. I wonder, Stacy, as we put all these things together, what role the government, state, local, federal, can play in making it easier and really improving the quality of life for Americans living with rare diseases and ultimately getting the diagnosis they need for those diseases.
My response to that is I continue to say, let's educate the public. I continue to say organizations like this one, continuing to talk to your congressional members, your governors, and also your local elected officials so that you can have support in terms of legislation that's passed when we start to look at policies that are put into place, as we start to look at the disparities in terms of, healthcare. If we look at in terms of, as Kevin and both Elisa stated earlier, it is about having those relationships. And I think that when we start to look at where disparities are in terms of the relationships and how doctors treat patients being able to come in, looking at legislation that looks at the patient, not only patient and doctor relationships, but also in terms of how you administer and how you interact with those patients and individuals.
I have one last question for all three of you. As we think about a more equitable world, and we hear that word so much around health equity, around financial equity, around everything, it's become this buzzword. I imagine it's quite different for all of you navigating rare disease. In your mind, to have a more equitable America for folks who are taking this journey, what changes do you think we need to see? Stacy, we can start with you.
I'd say access, and having access and the ability to know how to advocate on your behalf.
Kevin?
That pretty interesting anecdote along with that. I grew up in what most people would consider a working class family, but my dad was union, so we had really good health care. And, now being a financial advisor, I have some clients who are fairly well off. And one thing that is very interesting to me is when my clients who are very well off talk about going to the doctor, it is a completely different experience. My clients will say something to me like, I'm going to go see Dr. John Smith at Northwestern Hospital because he is the best left knee MCL, if you have low cartilage, surgeon in the country. Whereas the people that most people I grew up with and most people in my family, when we want to go see a doctor, we're like, I just need to go see a doctor. The level of experience that we're trying to, or expectation is just completely different. And somewhere along the way, I think we need to raise the expectation level or raise the bar quite a bit for people who are on the lower end of income and access, so that, maybe everybody doesn't necessarily need the concierge level service, but we definitely need to raise the standard.
Elisa?
Yeah, I agree with Kevin and I agree with Stacy. I think that doctors need to tailor the way that they treat patients. Not every patient is exactly the same. Have in mind that a lot of patients, if they don't understand the language, be able to offer translation, and not only translation, because translation is not enough. It's also explanation about the disease that they're just being diagnosed, or if the diagnosis is still not there, it's like, how can we help this family to find the answer that they're looking for? So doctors need to be a little bit more wanting to help the community and understanding the community that they're serving.
These have been really tremendous insights. Thank you for sharing your journey, which is obviously quite personal, but also your thoughts about making the world more equitable for all. And I think these are really great things that we should be thinking about. And clearly the RDDC has been thinking about as they've come together to really advocate on the behalf of all of this. Stacy, Elisa, Kevin, thank you so much for your time and for sharing your experiences with us. As you just heard, it is often quite challenging for rare disease patients to get a diagnosis. And so our next speaker is going to share more about the diagnostic challenges that patients face, especially underserved patients. And so I'm pleased to welcome Christian Rubio, Vice President of Strategic Advancement at Global Genes, a global nonprofit organization which supports individuals and families fighting rare diseases. Christian?
Thanks, Leslie. It's a real honor to be here, and thank you to the entire leadership of the Black Women's Health Imperative. It's been a wonderful partnership for the last year as we kicked off the coalition, and we've been really happily supporting the work. I wanted to provide a quick summary of some of the work done with generous support from Travere and in partnership with some of the great organizations in our Foundation Alliance. If we could pull up the slides, please. For those less familiar with us, Global Genes is working to improve the lives of patients and caregivers living with the challenges of rare diseases. We fight the fight to eliminate the burdens of rare diseases for patients and families globally, with specific attention to fostering diversity and inclusion in rare disease research, development and advocacy to expand and deepen community engagement, and to support better, more diverse data in research. Two areas of focus that we've been working on in the last year have been in reducing the diagnostic odyssey by accelerating the adoption of precision diagnostics, specifically gene sequencing, and its equitable access. And of course, accelerating progress toward and access to treatments and cures. Next slide, please. So over the work of the last year, we specifically set about to conduct an analysis with support from Travere Therapeutics and other great partners to identify barriers to diagnosis of a variety of patients representing underserved populations, to educate the broader healthcare community on how to mitigate their specific social determinants of health, with the hopes of increasing the pace of accurate diagnosis of rare diseases. Specifically, the effort aimed to better understand the diagnostic landscape for underserved education gaps and resource needs, to mitigate barriers and reduce time to diagnosis. Now, through a mix of literature review, analysis of available social media data and social listening, individual surveys and interviews with caregivers and clinicians, what we came to was a couple of key findings. Number one being that there simply needs to be more research done in this space, something that we as partners really want to continue to do. And also that there is the vicious cycle, and it can be documented, and those stories can and need to be told from the rare disease and underserved communities' perspective and underserved individuals' perspectives. As our panel just shared, the lack of knowledge and compassion experienced when talking to clinicians is even more compounded when there's a lack of comprehensive or adequate tests to genetic testing to really give alternate paths or even patient education to understand that they do have their own options. So I think the stories just really showed some of the potential if we can continue to document this and really understand that these are the underpinnings of how we address systemic bias and poorly written policy. We can change the future for ourselves, but we have to work together to do that. In parallel with the diagnostic study, we also performed, next slide. We also performed a study on the state of financial advocacy in rare diseases. And this is where we really start to see the whole picture, not only of the challenges of getting a diagnosis, but also what are the underpinnings? What are the differences that we just talked about in income level and understanding of the system that helps somebody navigate what their options are, whether it's through Medicaid or through private insurance. And there's been a wealth of data that came from this study as well. We'll be looking forward to sharing this continuously with the coalition and the committees as we go this year. And finally, looking ahead, next slide, please. Looking ahead, we're really excited to be able to work with BWHI and the Rare Disease Diversity Coalition, both on helping support the publication of RFPs for research impact grants and cultural competency, and really help build up the capacity of rare disease organizations to be able to bring out, really engage more diverse communities. We also intend to continue the Access to Diagnosis Committee to bring more of the recommendations that Dr. Clooney will be talking about later in the program. Of course, expanding our Rare Compassion program, which for the last several years has been out in the landscape, inspiring medical careers in rare disease by matching medical students and nursing students to rare disease patients and advocates to hear their story and understand what the real challenges are. And finally, one of our land to increase the to study and then increase the access to genetic diagnoses in partnership with Rady Children's and their network of more than 60 children's hospitals around the country. With that, I just leave everybody with the words of hope that, as we say in Global Genes, hope is in our genes, and with the entire rare disease community, that we're in this together, we're stronger together, and we can absolutely change the world for everybody at every level. Thank you.
Christian, thank you for that message of hope and humanity. That is what this organization, of course, is all about. I'd like to now introduce Juliet Choi, Chief Executive Officer of the Asian and Pacific Islander American Health Forum, to share the experience of the Asian community when it comes to rare disease. Juliet?
Leslie and our community here today, thank you so much. I would be remiss if I didn't extend a special acknowledgement and thanks to Linda as well as Tammy from the National Black Women's Health Initiative for bringing all of us together here. I know I only have a few minutes here, but I want to ask us collectively, because I know all of us who are joining in today and in our conversations beyond, what is our collective definition of communityship and neighborship in this dimension of rare diseases and bringing communities together? I know I was asked to talk a little bit more about the rare disease experience for the Asian American community. I think I can do a little bit of that, and at the outset, I want to share I don't consider myself an expert in this context, but in terms of the whole of our intent and desire to cultivate, curate, and bring this community together, let me just share a couple of questions and perhaps a couple of figures for us to think about together. And I want to come at this more from an immigrant community perspective. So for the Asian American community lens, as it relates to broader research and engagement with the federal government, since 1992, when it comes to research writ large with the National Institutes of Health, less than 0.2% of the NIH budget has been allocated to the Asian American, Native Hawaiian, Pacific Islander community. To state that more directly, again, since 1992, less than 1% of our overall federal government resources has been allocated to research writ large out of the NIH portfolio for the AA and HPI communities. Trying to parlay that fast forward to our conversation here and today for rare diseases. I think we are all here today because we have the best of intentions to engage, welcome, support families and communities as they are navigating for support, access to resources when it comes to rare diseases. I wish, candidly, I could share so much more what that narrative, what that story really means for the Asian American experience and if I dare to say, for the broader immigrant community experience, which includes the Latinx immigrant community, the African immigrant community, for the Asian Pacific Islander community, and so many more communities. So I do tend to take a glass as half full outlook. But for all of us, whatever our walks of life are, whether you're a policymaker, whether you're an administrator, whether you are, which I think personally and professionally is the most important role, is that voice for community, for family. And this is why I really center on that notion of communityship and neighborhoodship. But for this opportunity, this community to come together in the context of rare diseases, I will share from the immigrant prospect, immigrant community and family prospect writ large. Can we collectively imagine? I want to ask us to, like, maybe briefly close our eyes or carry this question forward. Can we imagine what today's conversation, which is so absolutely critical in rare diseases, can we imagine having this conversation with immigrant communities and families in their language, at their place of gathering in community, which I do think is a wholesale challenge for those of us that are convening today. I happen to speak an additional language in addition to English. I think for a lot of our partners in the audience today, we can imagine what if our own family member, our daughter, our son, our grandmother, our aunt, our uncle, we're facing a rare disease in our healthcare system today here in the United States. And I ask and I challenge us collectively, particularly from the immigrant community perspective, don't we, and of course we want to consider, how do we mobilize our resources to help those families get the support they need, the information that they need, that is in a language and a literacy level that is accessible to each and every immigrant family, but also in a cultural perspective that is a trusted source and very, very relatable. So in my few minutes today, I know, and while I haven't had the chance to meet and connect with each and every one of you individually and a community-wide perspective, I think for today's discussion, I really, really wanted to center not just the Asian American experience, but writ large, the immigrant community experience when we are having the conversation of rare diseases. Again, Linda and Tammy, thank you so much for bringing us together to face celebrate the successes that we have, as well as hearing from families and communities where things have gone well. But going forward for this broader community, our healthcare administrators, our policy makers, for those of us that get to sit at the community or family kitchen table, I just want to ask us low-hanging fruit, but not dismissing or undervaluing the import as we journey forward in 2021 and we center the race equity conversation, the health equity conversation. I know absolutely with total confidence that each and every one of us have the opportunity to bring additional family voices and community voices, whether it is in your respective organizations, coalitions, policy-making tables to bring all of us, our communities of color, but also families of color to the table, so that whatever policy-making conversations we have, we can that towards our families. And so with that, I just want to say on behalf of, I say this a little bit in a shy and humble fashion, if I may. I'm so grateful to all of you inviting the Health Forum to this conversation, but again, centering on that theme of what can it look like centering communities, families, and neighbors in this rare disease coalition conversation going forward. And whatever I and the Health Forum and our communities can do in coalition with all of you, I very much welcome. And again, once applaud Linda and Tammy for bringing all of us together, and especially bringing together our national experts, but especially centering communities of color. Thank you. And thank you so very much.
Juliet, thank you. And I'm honored now to introduce remarks from Dr. Marcela Nunez-Smith, who is the chair of the Biden-Harris administration COVID-19 Health Equity Task Force. Let's listen to her message.
Good day. I'm Dr. Marcela Nunez-Smith, Equity Coordinator on the White House COVID-19 Response Team and Chair of the U.S. COVID-19 Health Equity Task Force. Thank you to the Black Women's Health Imperative and the Rare Disease Diversity Coalition for inviting me to spend a few minutes with you today. Your work is vitally important, especially while the world seems singularly focused on COVID-19. We must ensure that lessons learned in one arena are applied across the board in our health systems. There's no question, COVID-19 has laid bare the enduring and entrenched racial and ethnic disparities in health and healthcare, and their predictability is part of the tragedy. Conversations that are happening more widely now about things like access to diagnostic testing, to treatments, to innovative new therapies, vaccines, inclusion and representation in research. These conversations have been happening in the rare disease community for decades. And we need to ensure this national conversation does not stop with COVID-19. The Biden administration has committed to prioritizing equity as we respond to the coronavirus pandemic, and also as we work to solve the structural disparities that persist within our health and social systems. Thankfully, our country is at a hopeful moment as we look ahead to increased vaccine supply and continue to make important steps to get this pandemic under control. And as we plan for recovery from the pandemic, the administration is committed to building systems that will help us to address these structural problems going forward. We are prioritizing robust data collection efforts to make people visible, and also prioritizing intensive collaboration in that work. We need to collect place-based data that allow us to operationalize care on the basis of things like social vulnerability and geographic markers. Racial disparities in health can only be fully understood when other data are also available. We need to know about food and housing security, environmental toxins and stressors, the coexistence of chronic illness, and more. In building better and more comprehensive data systems, we're making our healthcare system responsive to those social and structural drivers of health. And as we generate targeted solutions to mitigate the health disparities that have characterized this pandemic and build a system that will serve all in the future, we are relying wholeheartedly on collaborations at the community level. Many barriers remain. They cannot be overcome without partnership between the federal government and community organizations. These organizations are aware of the challenges their community members face in accessing care, and quite frankly, are accustomed to filling in the gaps. Not to mention the vital role these organizations have played and will continue to play in building trust. As I speak to you, you're experts in that. We know many Black communities, brown communities, others sometimes have a well-earned distrust of the healthcare system. And these doubts are only being fostered by rampant misinformation and disinformation campaigns. We want everyone to feel empowered to have meaningful conversations with trusted community leaders. Leaders in community organizations will be absolutely critical, vital sources of information, not only about vaccines, but really about testing, treatments, mitigation practices, and so much more. As we are working at the federal level to mitigate the COVID-19 crisis, we are building a system that will respond to the needs of all communities, in acute and chronic settings, to individual and systemic conditions. For instance, we can speak to diversity and representation in the phase 3 clinical trials for the currently authorized COVID-19 vaccines. Participation in medical research is a key component of care for many, many individuals. And this diversity ultimately makes research and science better. I know firsthand, as a rare disease parent, that diverse participation in clinical trials is absolutely crucial for the care and treatment of rare diseases. And this is something we must prioritize. Your voices in this work and in this space are absolutely critical if we are to respond to this crisis meaningfully and effectively and equitably. As the parent, as I said, of a child with rare disease, the work is very personally meaningful to me. And as a professional, I lean upon the knowledge and experience of the rare disease community in bringing light to historically ignored populations. The challenges of combating COVID-19 are vast. This work will necessarily involve a whole lot of creativity, determination, and willingness to tackle complexity. These are lessons we can learn from you. And this is why I thank you sincerely for your energy, for your partnership, and for your leadership. Thank you again, and be well.
Thank you, Dr. Nunez-Smith. And now I'd like to share a special message from Representative G.K. Butterfield. There is no doubt that with appropriate legislative and regulatory tools, policymakers can support rare disease patients, and particularly patients of color. Congressman Butterfield represents North Carolina's 1st congressional district. He serves as a member of the influential House Energy and Commerce Committee, where he sits on the Health Subcommittee, and has been an advocate for access to quality health care and eliminating health disparities. He's a leader in Congress. Congressman Butterfield is also a former chairman of the Congressional Black Caucus and also serves as senior chief deputy whip, working with the Democratic leadership to help formulate policy and rally support for the caucus's legislative priorities on the House floor. We are honored to have Congressman Butterfield engaged with this coalition, and we look forward to hearing his message right now.
Thank you to the Black Women's Health Imperative and the Rare Disease Diversity Coalition for inviting me today to speak to all of you. I wish I could be there in person, but it is wonderful to see this vital work moving forward during these very challenging times. Each of you is so important to those families and individuals all across the country living with a rare disease diagnosis and those still seeking answers. The work you do is incredibly important, and I am thrilled to participate in this vital meeting. As all of you know, if we want to combat rare diseases, we must increase our investments in research, expand and encourage participation in clinical trials, and create incentives for companies to develop the next generation of treatments and cures. This means getting buy-in from members of Congress so that we can pass bills to help accelerate research and spur innovation. And that's where I fit into today's program. I serve as co-chair of the Congressional Rare Disease Caucus. This bipartisan caucus serves as an informational hub for members of Congress and their staff. We work to educate members on issues facing the rare disease community, like the investments needed to develop treatments and cures, the economic impact of rare diseases on patients and their families, and the challenges in getting a diagnosis and accessing specialists. In the last Congress, we had success in achieving a 4-year extension of the rare pediatric disease priority review voucher. This Congress, I am working with a small group to introduce legislation to increase diversity in NIH-funded research and clinical trials, an issue we know so much about. I am grateful for all of the work that you do. I am proud, so proud, to stand with each one of you and the rare disease community. Please know that you have an advocate in Congress. I am your advocate, and I will continue to be your champion in this fight. Be blessed.
Thank you, Congressman Butterfield. We're excited now to be joined by Connor Sheehy, who serves as Deputy Legislative Director in the Office of U.S. Senator Tim Scott, where he also manages the Senator's health policy portfolio. He's going to talk with us about the role of congressional policy in supporting rare disease patients. Connor?
Thank you so much, Leslie, and thank you so much to the Rare Disease Diversity Coalition for the opportunity to participate in this absolutely crucial conversation. This conversation and the coalition more broadly, they bridge two of Senator Scott's top policy priorities. On one hand, combating health disparities, and at the same time, helping to champion rare disease patients. We know that there are 7,000 known rare diseases, but only 5% of them have an FDA-approved treatment option. So Senator Scott has fought and worked tirelessly to facilitate access to innovative treatments for the rare disease patients across the country. To take a step back, these are longtime priorities for Senator Scott. Each year, we work on a bipartisan basis to partner with Senator Cardin's office to advance and unanimously pass the National Minority Health Month resolution. A few years ago, we reached across the aisle to work with Senator Booker and partner on game-changing historic legislation to bring innovation in prevention, treatment, and data surveillance for the 100,000 Americans affected by sickle cell disease, which we know has a disproportionate impact on communities of color. More recently, the senator has become one of the leading champions in the Senate of a bipartisan push to facilitate value-based arrangements for innovative therapies. If you look at early last year, we had roughly 365 different investigational gene and cell therapies in the pipeline. Roughly 1/3 of these were for rare diseases in particular, and nearly 20 were for sickle cell diseases. But without access to these products, we will see investment dry up, and we'll see a loss of hope, a loss of cures, a loss of treatment options for patients who are holding out across the country, particularly for patients who are covered by Medicaid, patients who live in vulnerable and underserved communities. Now, looking forward to this Congress, I think this is an area where there is ample ground for bipartisan, meaningful, consensus-driven reform. We are working on a bipartisan basis with our friends on the Senate Finance Committee to develop innovative pathways to ensure diversity in clinical trial participation. We're working with friends on the Health, Education, and Labor and Pensions Committee to ensure that the CDC's REACH program, which helps to invest in community-driven initiatives aimed at addressing racial disparities and has done so for years, that program can continue to flourish regardless of spending level in any appropriations bill. So we're really, really hopeful that these are areas where we can come together, Republicans and Democrats, and advance game-changing legislation for patients. And I'm hopeful particularly that as we enter into conversations around user fees, that rare disease patient voices and perspectives and lived experiences are a central part of those conversations. So I think given Senator Scott's committee positions, given his track record of bipartisan work on these areas and on addressing these issues, I think there's a lot of grounds for optimism. And I look forward to working with you all and working with friends on both sides of the aisle to ensure that we can make a meaningful difference for rare disease patients and that we can meaningfully combat health disparities in the coming years. Thank you again for the opportunity.
Connor, thank you. And as we all know, access to care is a critical part of this conversation as well. Alan Balk is the CEO of the National Patient Advocate Foundation, which is dedicated to improving healthcare access and quality and affordability for all patients and families at any age and any disease stage. I'm pleased to welcome Alan and to share his perspectives about the problems facing patients and solutions that we can implement to address them.
Thank you so much for that kind introduction. I want to extend my thanks also to the Black Women's Health Initiative to hosting this coalition, inviting us to be part of this conversation, as well as the steering committee. I know we have only a brief period for remarks, so I'll try to stay brief and within the time allotment. A lot of what we do every day has already been mentioned by Kevin and Stacy and Alyssa and other speakers so far. We're actually two organizations. So the Patient Advocate Foundation, for the purposes of this conversation, I'll focus on just one attribute of what we do as an organization, and that's our navigation services. And that's where we serve generally about 150 to 200,000 patients a year across the United States. But our case management division is a very, what we call personalized navigation services. We provide a very intense service to patients who are suffering an acute issue in the world's most expensive or complicated healthcare system. And a lot of it involves dealing with different social determinants of health, issues around access to care, financial toxicity, you name it. We're sort of living at that triple threat crossroads that Linda alluded to. Sort of a play on that is it's mostly low income patients. So our average patient has an income of $24,000 a year or less. We're serving a variety of different diseases. We serve patients representing 250 different rare diseases or more last year alone. It's a racially and ethnically diverse population. So about 45% of the patients that we serve, of that 20 to 25,000 a year, are non-Caucasian. So African-American, Latino, Hispanic Latino, you name it, it's in our patient population. So we're really, and they're geographically dispersed. So we're sort of at that intersection of patients who have a complex disease, who are low income, who have racial, problems associated with health equity, racial and ethnic diversity, and then geographic issues. And what that translates into is it takes us on average about 3 weeks to help a patient in a meaningful way. And those are issues, things like transportation, housing and food insecurity, insurance access, insurance literacy, unpaid medical bills. And what we know about the rare disease experience, especially when you overlay that with racial and ethnic challenges, is it just makes it that much harder. So when you have, the more touch points you have with the system and the more complicated your case is, the harder it is for you as an individual to engage and experience and be effectively treated and have a successful outcome in this health system. And a lot of the problems, in addition to the clinical ones that patients face, a lot of the non-clinical aspects of care are exacerbated as well. Issues around caregiver burden, childcare, the relationship, the level of trust between the family, the patient, their family, and the care team. You name it, it's just that much harder. So we feel like, and the word's already been mentioned many times, there are patient populations who really need a navigator consistently applied in their care journey. That's what we do as an organization. We feel like for the rare disease community and other subpopulations of patients who really have particular struggles that compound the challenges of our healthcare system, that providing a navigation model, not just clinical navigation, but really around what we call social needs navigation, those other aspects of care, is really central. The other organization that I'm privileged to be part of is the National Patient Advocate Foundation. That's our policy and advocacy arm, and that's where really are advocating for how to create a healthcare system that really is organized and delivered in the way that matters most to patients. And there, what we're talking about, and I think Kevin alluded to a lot of this, is how do you, patients obviously need to be trained and empowered to engage in their care team and know what powers they have. But at the same time, you have to build a health system that actually anticipates and welcomes that engagement. And from everything from shared decision-making to care planning to how outcomes of care are measured and quality measurement, you really have an opportunity to incorporate what matters to patients into those elements, and doing that through the lens of unique populations of patients. And I think the rare disease population, including those, and especially those who have other factors involved in their disease journey around race and ethnicity, are those who really need those systems to be built in a way that their engagement is expected and invited, and the systems and processes do that openly and willingly, including the training on the clinician side, so that everybody has a patient experience where they feel like they've been trusted, they've been listened to, and the care is personalized to them.
All right, Alan, thank you so much for your remarks today. I'm really excited to introduce our guest speaker this afternoon, Olympic gold medal winner and former NBA player Alonzo Mourning. Alonzo spent most of his 15-year NBA career on the Miami Heat, and since he retired in 2009, he's been inducted into the Virginia Sports Hall of Fame, the Naismith Memorial Basketball Hall of Fame, and the FIBA Hall of Fame. Today, Alonzo, or Zoe, as he's commonly known by those who know and love him, is the Vice President of Player Programs at Miami Heat and is responsible for ensuring both the professional and personal development of Heat players while providing direct support and one-on-one mentoring. Alonzo was diagnosed with a rare kidney disease, FSGS, and was forced to get a double transplant in 2003 in order to survive. Alonzo is going to share some remarks with us, and then we'll get into our conversation. So, Alonzo, or Zoe, the floor is yours.
Leslie, thank you so much for having me. It's an honor and a pleasure to be a part of this conversation in conjunction with the Rare Disease Diversity Coalition. First of all, with the 30 million Americans who have rare diseases, and also in relation to the knowledge that I know about the disease that I have, which is focal segmental glomerulosclerosis. It's a disease that scars the filters of the kidney. And I know that over 20 million Americans suffer from chronic kidney disease. And there's another 20 million who aren't aware of it. You know, the one thing that I want to encourage all the listeners out there, you know, as we have this discussion, is to value understanding the importance of just going to the doctor and getting a checkup. You know, I know that from a financial standpoint, you know, there's a lot of different obstacles that many people face, especially in our underserved communities, which we dominate a lot of the statistics of diabetes and hypertension and things of that nature, which are silent killers. But the long and short of it is a lot of some of the diseases that we do deal with can be prevented if we catch them early. And I want to encourage all of those listeners who are out there to understand the importance of just going to the doctor at least once a year and just getting a regular checkup. I know for a fact that I would have ignored the symptoms that I had if I did not have a mandatory checkup as a professional athlete. We have preseason physicals as well as postseason physicals. So that's how I found out I had what I had. Otherwise, I would have went on and ignored a lot of the discomfort and the symptoms I had, which we normally do, and it's human nature. You know, we're told, especially as men, we're told to toughen up, suck it up, you know, get back out there. And, but then the long and short of it is that, you know, we all have to be active participants. We can't wait for somebody else to do it for us. We all have to be active participants in our own health. And a large part of that responsibility is going to the doctor once a year and getting a checkup.
I'd like to hear you talk about this agency that we should all have as people, whether we're an NBA player or not. But Let's go back a little bit, because you're playing your best basketball, you're at the height of your career, and all of a sudden you're starting to feel these symptoms. And as you just acknowledged, had you not had the requirement to look into what was going on, you would have played through them. What were the symptoms? What were you experiencing at the time?
An extreme amount of lethargy. I had headaches, very fatigued, lethargic. I had swelling in my legs and what have you. And these were all signs of renal failure. And but I still, having those symptoms, I still was going to work. You know, I still went out on the court and competed for a gold medal and won a gold medal during that particular time when I was dealing with all those issues in Australia. And on top of that, I ended up getting Olympic Basketball Player of the Year. So it kind of speaks to, you know, my resiliency and toughness and from that perspective, you know, but it wasn't smart, because if I would have known, I probably wouldn't have been allowed to play if they knew what was going on inside of me, you know. So so those are the symptoms that I felt. I was very fortunate enough to come back from Australia after winning the gold medal and having my preseason physical, and then they noticed some abnormalities in my body chemistries, my creatinine level, which I was educated on, but at that particular time, I didn't know what it is. It's the gauge that gives you the gauge for your kidney function. And my creatinine level was a little elevated. They thought I was a little dehydrated. I told them about the other symptoms, and then the long and short of it is they did a biopsy, an emergency biopsy, you know, to look deeper and to see if my kidneys were functioning correctly. And then come to find out after the biopsy, they identified that I have this rare kidney disorder called focal segmental glomerulosclerosis. It's a disease that scars the filters of the kidney, and it's a disease that's very dominant in the African American community. And I was very fortunate. I was one of the fortunate ones to have been able to do the research and try to identify and find some of the best doctors. And I'm going to tell you this, a lot of us don't have the ability and the resources, but I encourage all of us, if we can get a second, third, maybe even a fourth opinion, do it. Because, you know, I had some doctors that told me one thing and I had some doctors that told me another. And that doesn't mean they're right or wrong. That means that they're giving you their hypothesis. They're giving you their educated guess. So, so that's why they call these doctors health practitioners, okay? Because they practice medicine. You know, that doesn't mean they're perfect at it. That means they practice it. So they're going to give you their educated guess. And this person's educated guess might be different from this person's educated guess. So you have to get enough educated guesses to where you can form your own conclusion about what you want to do about whatever you do or the obstacle that you're dealing with.
I want to talk a little bit more about that, but you know, we go way back, Zoe, a whole hour. So I'm just going to start calling you Zoe, because, you know, everybody here thinks they know you, and they're all Hoya fans, and everybody wants to have that relationship with you.
I appreciate the Hoya love. I appreciate it.
How long do you think you were playing and living with kidney disease without knowing that you had kidney disease? And I'm asking that because you touch on something that a lot of us in the African American community do, which is sort of like, we suck it up, right? Yep. We know something's not right, something's not feeling right, but we'll put it off till we can get to it. And some of us don't get a chance, tragically, to get to it. Right. So how long were you dealing with these symptoms?
You know what, Leslie, I'm gonna tell you this, and I'm really guessing, but as a professional athlete, you deal with all types of aches and pains and discomforts, and I'm talking about professional athletes on so many levels, not just basketball, but football, hockey, baseball, you name it. And I'm not gonna get into the other difficult details of what team doctors have to do to kind of manage it, you know, because there's a lot of things that factor into guys getting back on the field and playing under some uncomfortable circumstances, you know. So, and some of them, they may raise red flags. They really, you know, what they offer us for us to get back out there and play through the discomfort and the pain, you know, because it's a business and it's about winning. But the long and short of it is that I felt like I was dealing with something for at least 3 or 4 months and didn't even realize it. Wow. Didn't even realize the severity of it. But throughout my whole career, there wasn't a season that went by where I wasn't playing through some type of pain and discomfort, but that's why they pay you the big bucks.
So 3 to 4 months of enduring this.
Yeah.
I learned today from Linda Goler Blunt that it takes on average 7 years for some folks, particularly African Americans, to get a clear diagnosis. It took you months to get that. Clearly, you were Alonzo Mourning, right?
Yes.
And you had access to different resources.
Right.
That had to be a humbling thing for you to have to confront your mortality after months of playing and being what you thought was Superman.
Well, you hit it on the head. It brought me to my knees. It really did, because I lived a professional athlete's dream. I mean, I'm getting paid extremely well. All-star, defensive player of the year, first team all NBA, Olympic gold medalist. I mean, this is all the accolades that, other than, winning the NBA championship, all of those things kind of factor into what your focus as a professional athlete on any level. That's their dream of accomplishing all those accolades with the hard work that you put in and what have you. But as you touched on earlier, I'm Alonzo Mourning, so I had access to healthcare. You understand? The unfortunate thing that there's millions of Americans out there, which I hope our government really prioritizes, is making sure that everyone has access to healthcare, affordable healthcare, because just a regular checkup, like I stated earlier in the conversation, just a regular checkup, you can be proactive and prevent a lot of these things from escalating. You said 7 years. That's baffling to me, because throughout that 7-year period, I'm sure that a person and it's amazing how the human body just adapts to discomfort, because I was dealing with discomfort and my body just got accustomed to it. So I went on with my life. And that's what a lot of people do. They go through these discomforts and these ailments and what have you, and they ignore them until it's too late. It was too late. So, I mean, like I said, I was fortunate enough to have the resources to identify the right who that could help me. And I found the best nephrologist in the world, Dr. Gerald Appel, who basically saved my life. So
you had kidneys that were failing, but you had the heart of a champion. And you make this comeback in your career, even after the kidney transplant in 2003. Was there ever any doubt in your mind that you were going to get back on the court and you were going to achieve your dream?
Leslie, I'm human. You're going to have doubts. Okay. I was scared. I'm going to tell you a quick story, and I don't know how much time I have, but I'm going to tell everybody a quick story. The day after my transplant, I'm laying in the bed at Columbia Presbyterian, and I'm looking up at the ceiling. I got an IV in my arm, IV in this arm, IV wires hanging all off of me. I have heart monitors on. I got a catheter in. I got all these wires and tubes hanging from me. And I was probably after feeling like you said, superhuman, and leaping tall buildings in a single bound, and playing extremely strong and feeling invincible. I was at my weakest state that I'd ever been, other than being an infant. And immediately I started having, in the room by myself, I had a conversation with God. I said, God, if you could just give me my strength back, which is something that we take for granted, my health and my strength, because without your health, you have nothing. I don't care what you have. I don't care material things, how big your house is, your car, how much money you got in your pocket. None of that matters. You don't have your health, you have nothing. So, and I had it all. But I was humble. I was in my weakest state, and I asked God to just give me my strength back, and I promised him that I would use not just the basketball career, but my life, use it to serve others, to do his will from that perspective, and God willing, he gave me my strength back. I was back on my feet. I started playing basketball. I started working out again. 8 weeks later, post-transplant, I started back in the gym, walking on the treadmill, taking baby steps. And then I realized that, wow, I started running again. I said, wow, I could probably get back on the court again. So my doctor started giving me more rope, and I took advantage of it. I got stronger. I started running faster, and my doctors accredited my fast recovery to how great a shape I was in before the actual transplant happened. So after all that happened, 9 months later, I was back on the court competing at a high level.
And you win a championship 3 years later in 2006. And
Yeah.
we saw the glory, but we didn't know the whole story
No.
leading up to that moment. I presume you use that as something to inspire others who are going through their own journey.
Leslie, I received so many emails and letters. To this day, I receive emails and letters from individuals that aren't just going through obstacles with their kidney, but so many other health obstacles. And they share their story with me because everybody has a story. Everybody has something that they're going through, and they tell me that, I inspired them to get up and to not succumb to what they were dealing with, to overcome it. So that inspired me to keep moving, to keep going. It's amazing how a lot of people don't realize this, how much we impact people every day, just with our actions, a smile. Now we can't handshake now, but and people can't see our smiles, but how you greet people, what you say to people, it makes a difference, and just, I didn't realize how my life and the adversity that I went through helped inspire and change other people for the better. So I was, it was a blessing in disguise.
A blessing in disguise. I know that since that time, since your years of coming off the court and doing something different around basketball, you have also spent a good deal of time raising awareness around rare disease, around kidney disease. There's a high school named after you. There's Zoe's Winter Groove. Every time we look around, you're doing something to deposit something into the community. And I know that has a lot to do with your upbringing, and that's deliberate, right? To whom much is given, much is required.
Sure.
Can you talk a little bit, though, specifically about what you're doing to help rare disease patients?
Oh, yeah, well, first of all, just nothing specific about rare disease, but more importantly, trying to get people to be active participants in their own health. I'm a full-fledged vegan now, and I've noticed a tremendous amounts of benefits in that because food is healing. Food can be our medicine. And I want to encourage everybody to explore vegan options, because we can actually heal ourselves with the things that we put in our body from that perspective. I'm a huge advocate of holistic health. I know Western medicine, obviously, there's a lot of benefits in Western medicine, but there's other alternative ways of healing the body from that perspective. So educate yourself on other ways. And I've been fortunate enough to have the best of both worlds with a medical doctor who has given me his advice, and then a holistic doctor who have given me his advice. And I've kind of combined both of them into my world, and it's helped me sustain 17 years post-transplant, it helped me last this long and keep this kidney this long, so I'm looking forward to staying on track and hopefully experiencing another 17, 20 years with this kidney, so it's very difficult. It's a lot of work. You just can't wait for it to happen. We have to be active participants, and a lot goes into being an active participant. Exercise, eating right, getting the proper amount of rest, drinking a lot of water, flush your body out, things of that nature, getting rid of the toxins in your body and things of that nature. But from an educational standpoint, I think we all need to be students. We're the CEO of all of this. We are the CEO of this company right here, our bodies. So we got to make the right decisions for that company. So I try to echo this and talk to kids about developing the right habits as it pertains to taking care of themselves and their bodies. But I have no particular initiative that I have tied myself to other than the Glomerular Institute at Columbia Presbyterian. They're doing a tremendous amount of research there. I raised over $2 million years ago, to help kick off the Glomerular Institute, as they continue to find cures for rare kidney disease, so that's much of my work in a nutshell, but outside of that, education, the work that I do in the inner city community, especially in Overtown, is something that is near and dear to me, helping these kids value literacy, which is extremely important. I always tell my kids, I tell them, my biological kids and also the kids that are in my program, which is, I got over 500 kids in my program. And I tell them, I said, if you can't communicate in this world, you can't survive. So it's important for them to embrace reading and value literacy and education from that perspective, so they can continue to create options for themselves.
That's incredible. And the advocacy that you're doing right here, I think, is so significant. I have to ask you, from your experience and what you've seen so far, what do you think should be sort of the number one priority to address disparities in the rare disease community?
Wow, that's a difficult question, simply because I think a lot of it has to do with the resources and the access that people in communities of color, Black and brown people, the access that they have. Many of them just don't have the access. And I commend Michael Jordan. I'm sure you read about some of the investments that he's made in healthcare, providing access to healthcare in impoverished communities. So I think there needs to be more of that. So people can just something as simple as just getting their blood pressure checked. It's just people have gone years without even getting their blood pressure checked, and they might be in their 50s, and they've gone years without getting it checked. Something as simple as that, you can identify if they have some issues going on. So the long and short of it, and then you can teach them dietary habits and needs and what have you. So it's an educational process, and I think that if they don't have the access, then I don't think people are going to go out of their way to get the checkups that they need to get, unless something is extremely wrong. And you shouldn't have to wait. You should be, like I said earlier, we all need to be more proactive.
I think you've shared some incredible insight with us. I have to ask you just one last question, and that is, what advice you have for all of us on our journey. I can only imagine that when you are faced with your own mortality, there's a sense of urgency and intention about living differently.
Right.
And so what message would you have for the rest of us outside of who may not be navigating a rare disease, but are navigating life, as someone who stared that intersection of life and death in the face and survived?
Well, I speak about this in my book, and I think a lot of it has to do with how we think, and it's easier said than done. I feel like the body follows the mind. I do. And if you give up here, then the body follows it. But if you put together a plan, a strategy that will help navigate you through or overcoming the obstacles that you may deal with, because I'm going to tell you this, you're not going to be the first. You're not the first person to go through something. You're not going to be the last. So we're all going to go through something. So, I look at Magic Johnson, what he had to deal with HIV and AIDS, and how he used that as a positive. Obviously, he had the ability and the resources, but he used that to educate people and to raise money towards research and what have you. And now he's living an amazing life. Everybody looked at him and they said, well, he had a death wish on his head. But look at him now, 30 years later. And same with me, I could have easily given up. I had people calling me, telling me no, don't go back and play again. don't do it, you know. But it's, if I listen to those people, then I wouldn't be a world champion today. You know, if I tried to reinvent myself and do everything that I could to try to combat what I was dealing with. And I think so many times people start feeling sorry for themselves with whatever they're going through. And instead of really getting started with living, instead of getting started with dying and sitting still, you got to keep moving in life. And as soon as you stop moving, that's when you start dying. So the long and short of it is you keep moving, keep your mind stimulated, keep educating yourselves on ways that you can continue to heal your body.
Well, Alonzo Mourning, we are so grateful for your time this afternoon. We're grateful for the advocacy that you are doing around both rare diseases and just literacy and the very many things that you do in the community to make lives better. We are so glad that you have the heart and the kidneys of a champion, and you are still at it. And so thank you again for your time. We've heard a lot of inspiring patient stories today and expert insights, but this is really about advancing action. And you've given all of us an action plan, a personal one, to make ourselves the very best we can be. So thank you, and thank you so much.
Thank you for having me, Leslie.
So great to talk to you. All right. So the esteemed steering committee here for this coalition has been hard at work, largely behind the scenes, over the last year, putting together these actionable recommendations. And so I'm going to turn things over to Tammy Boyd, Chief Policy Officer and Counsel at the Black Women's Health Imperative, who will introduce these recommendations and share more about the coalition's plan for the year ahead. Tammy's going to be joined by her fellow members of the RDDC Steering Committee, Dr. Garfield Clooney, National Medical Association Board of Trustees and Treasurer, Dr. Elena Rios, President of the National Hispanic Medical Association, and Dr. Marshall Summer, Director of the Rare Disease Institute at Children's National Hospital. Tammy?
Thank you, Leslie. It was quite a motivating and inspiring conversation. Thank you all for being here today. This is an incredibly significant week in the rare disease community as we prepare to commemorate the upcoming International Rare Disease Day on February 28th. Today's RDDC full coalition meeting is important for several reasons. One of them being that we are now announcing the Rare Disease Diversity Coalition's official recommendations for achieving impact in the year ahead. I've invited a few of my fellow RDDC steering committee members to join me in doing this. As Leslie mentioned, Dr. Garfield Clooney for the National Medical Association, Dr. Elena Rios from the National Hispanic Medical Association, Dr. Marshall Summer, Director of the Rare Disease Institute at Children's Hospital. As Linda mentioned earlier, we convened a steering committee of influential industry leaders, advocates, and stakeholders. We knew it was important to take a deep and substantive dive into the most pressing issues facing diverse communities with rare disease and define the best ways for us to take action to address them. Our goal was to prioritize where this coalition could have the most impact. We developed 4 working groups: research and clinical trials, delays in diagnosis and treatment, patient and provider engagement, and government regulation, legislation, and policy. These groups spent 6 months reviewing the existing literature, policy proposals, and research. They also heard directly from panelists and patient caregivers. By the end of 2020, our working groups developed over 75 recommendations tackling health disparities in rare disease. We're proud to announce that today, the Rare Disease Diversity Coalition has released a detailed paper which includes many detailed and substantive policy recommendations titled Charting the Path Forward for Equity in Rare Diseases. Specifically, the paper provides an overview of the issues in the full set of working group recommendations with a focus on the 11 core recommendations which have prioritized as the most important for the coalition to focus on for 2021. I want to stress that these recommendations are only the beginning of the RDDC's work, and they will serve as a preliminary roadmap and guide. However, we know that we will set the stage for future efforts to build a more equitable health system for people of color with a rare disease. And now I return to Garfield Clooney.
Thank you very much, Tammy. Good afternoon, everyone, and thank you for inviting me to talk about what the Delays in Diagnosis and Treatment Working Group has been doing. Before I continue, and I don't have much time, I just wanted to thank again Linda Goler-Blond and Tammy Boyd for asking me to participate in this awesome project. And I commend the Black Women's Health Imperative for convening industry advocacy and community leaders to help reduce racial disparities in the rare disease community. I co-chair our working group alongside my amazing and very smart co-chair, Kimberly Hogstad, who's from Action Partners, who I'm sure is out there in cyberspace listening right now, and also had the privilege of working with a wonderful and dedicated group consisting of persons with rare diseases, caregivers of persons with rare diseases. You heard from Elise Callejas earlier. I hope I pronounced your name correctly. She is in our group. As well as others who work in the rare disease space, as Tammy said, brainstorming every 2 weeks for several months to come up with solutions to barriers to diagnosis and treatment of rare disease. It was quite a commitment and is quite a commitment worth every minute. And as barriers to diagnosis and receiving adequate care are all too familiar, especially in the minority and rare disease community. Though we generated many goals, as Tammy said, we honed in on 3 goals to help overcome these barriers, and they include to create, improve, and increase the trust of healthcare systems for rare disease families, to improve access to care and treatment, and to improve access to a person with a rare disease to advocate for themselves. Although these goals involve trust of the medical system played a part in all, although the first goal involves trust was sort of integral to all of these 3 goals. This was a tremendous challenge, not unlike the challenge the US is facing right now with COVID-19 vaccine hesitancy, which is in part due to things like the Tuskegee syphilis study and Henrietta Lack's story, as we heard earlier. In all our lives, once trust is broken, it's hard to get back. It's not impossible, but it definitely is hard. And as a high-risk obstetrician that sometimes takes care of women with rare diseases and minorities, underserved populations, I can't overemphasize how trust impacts care in a positive way and outcomes in a positive way. So just going to go over our goals just a little bit, just briefly. One of our first goals, again, is to create, improve, and increase trust in the healthcare system for rare families. And one of the main challenges was, as you can imagine, these historical experiences, wrongdoings, provider beliefs, undocumented status, all create an inherent fear and mistrust of the healthcare system. And some solutions that we came up with was involved building trust and connections through culturally competent community health workers. These are trained public health professionals who serve to bridge communities, healthcare systems, and state departments to also provide a diverse network of healthcare providers where patients can feel comfortable. When you see someone who looks like you might feel a little more comfortable with your care, and the trust issue might not be as great. Another solution involved providing culturally competent educational materials, videos, and so on to community centers and churches where these very patients may live, and to help them know their rights and how to access care. Another one of our goals, as I mentioned, was to improve access to the treatment of care, so access issue. And so, our challenge was looking at how do we increase access to providers and specialists that can treat adult and pediatric patients with rare disease, and improve culturally sensitive training for providers and transition education for pediatric to adult cases. And telehealth obviously is going to play a great deal in this solution because, as we've learned with COVID, not everyone lives near a large medical center, but telehealth kind of helps to bridge that gap. And also there are centers of excellence at larger institutions, and partnering them with smaller community institutions can also help eliminate the burden of cost and travel and decrease access issues. We also are looking into trying to help align electronic medical records and mobile apps and so on to help the shareability of information when patients have to go to different providers. And lastly, which is really, we heard a lot about this today also, is to help persons advocate for themselves. And one of our challenges we found as we talked to our group was the lack of knowledge of family health can be a big barrier, and you don't even know what your family has, because there's sometimes a stigma around talking about family histories, and also undocumented status can also make you not want to go out there and advocate for yourself in terms of getting care. So some of the solutions we came up with was something called a Know Your History campaign, which is something similar to, I'm sure you guys have heard of the Know Your Rights campaign, which is sort of part of the criminal justice system. And it's really, this would be really targeted to expectant mothers and young parents. And it really is to help or assist the younger folks in reaching their older family members before they pass on or they don't have access to them anymore, so that they can know what history is in their family, and so they can help better advocate for themselves in terms of their care. And also the CDC has a great module for community health workers, and these are the ones that I talked about before, the connections in the community, and adding a rare disease component to that toolkit. So those are some of the things that we looked at, and we heard a little bit more about knowing what the next step is. And in terms of advocating for yourself, it's really helpful if you know what your plan is or what your plan of care would be. And so also establishing standardized care maps and care plans for rare disease that can be customized and individualized to individual cases and so on, so that a person who's working through the rare disease diagnosis can know what the next step is and what the best plan is for them. So as you can see, there's a lot of work to do. We've done a lot already, but there's a lot more to do. And I look forward to working with my team as we move into the next phase and begin our strategic action plan. We have our work cut out for us, but it's well worth this endeavor, so that hopefully we can make an impact in reducing or eliminating the barriers associated with care for individuals with rare disease. Thank you.
And next we'll hear from Dr. Elena Rios from the National Hispanic Medical Association.
Thank you, Tammy. And thank you, Linda, for asking me to be a part of the group. I wanted to just say that we had a great conversation also in our meetings last year. And I want to thank everybody on the team for the patient and provider education and engagement group. So we had 4 different recommendations here. I'm not going to read every detail, but the most important concepts. First is to educate, equip, and engage healthcare providers to deliver culturally appropriate care, which impacts the many facets of the lives of minorities living with rare disease, especially to have cultural awareness and bias training, including a pilot project for healthcare providers. Also, there should be a directory of culturally competent training programs that really hasn't been developed in the country. Second, we thought we really need to increase the number of people from marginalized groups who actually pursue health professional careers. Indirect benefits will be great for all people of color, but especially those living with rare disease. And the Rare Disease Coalition would work with the AAMC, the Association of American Medical College, to expand curriculum focus, teaching medical students and residents about the importance of looking for rare diseases, and especially among diverse patients. Also, I think the curriculum project would look at helping to advance more minorities into faculty positions, because without faculty positions and role models, our medical schools don't look very attractive to minority students. Also, mentoring, cultural sensitivity, the use of interpreters, and especially now with COVID and having a mask, looking at sign language interpreters with the recent focus on clear masks. We also thought that there should be increased engagement from communities of color in patient advocacy groups. There would be a development of a guidance document for patient advocacy groups to aid them in better supporting diverse rare disease patients and caregivers, especially caregivers, who need more information too, not just the patient. There's a whole list of things that could be done for patient advocacy groups. One is to look at the governance and have diversity on the governance level. 2 is to have events that offer scholarships to patients and their caregivers who can't afford to go to the major events of patient advocacy groups. 3 is to have more communication channels, such as websites and social media profiles that really promote diversity and diverse patients like the patient we heard from today. Next is to have more collaborations with multicultural medical organizations. And I'd say doctors, nurses, pharmacists, we need to have more role models for our rare disease families to get to know, feel comfortable with. And then lastly, we wanted to increase medical literacy and patient confidence among the rare disease patients and caregivers. This campaign would include a guidance on the ABCs of your newly diagnosed disease. And also, I think the last thing here is to increase access to more information through the educational campaigns of the Rare Disease Coalition. So thank you very much.
Thank you, Dr. Rios. And next we'll hear from Dr. Summer.
Hi, Tammy, thank you very much. It was my pleasure to actually chair the Research and Clinical Trials group with Linda Blount. And it was actually a very interesting experience for me. Rarely do you get to apply what you learned in real time. So I'll go off script for a second and say that in our vaccination efforts at Children's National, some of the lessons we learned actually from the Black Women's Health Initiative were actually put into play there. So already you're having an impact, so well done. Why is research so important, and why is it so important for people of color in the rare disease field? This field has grown tremendously. We went from a handful of diseases in the 1990s and 2000s to probably over 8,000 different conditions now. Without research to understand the pathophysiology of these conditions, the clinical course, we can't develop good treatments, we can't understand the disease and the disease outcomes. And this is as important, if not more so, in communities of color than it is in any other community, because they are often more severely impacted by rare disease. We looked and talked to a lot of families. We looked and talked at actual studies to look at what the recruitment rates were, and disappointingly, they were not great. So there's a problem there. It's a measurable problem, and it's one we need to do something about. So when we started looking at solutions and recommendations, we kind of hit upon two things, and two sort of base concepts, I would say. One of which is a lot of patients have trouble accessing research studies. Most academic research studies tend to take place around a major academic center. A lot of our patients in communities of color do not have access to that, or they're remote. So there need to be flexible models. There need to be methods of outreach to those communities so that they can actually participate and even know about the research that is going on. And that means that actually a lot of researchers need to get out of their comfort zone to do that. So pipeline issues and economic and academic issues that prevent these communities from getting in, poor communication, understanding who you're talking to and how you should be talking to them are also big issues that we need to address. And I think the two speakers just before me, Dr. Rios and Dr. Clooney, outlined that beautifully. And those things continue on into the research field. The next, though, are some structural issues around research that I think prevent and create barriers to entry into research, particularly in clinical trials. Given the cost of development of new therapeutics through the FDA and through the regulatory process, there's a real pressure for homogeneity. And that means that oftentimes people designing these trials want everyone coming into the trial to look the same. That's a huge mistake. One of the things we do need to address, and this needs to be addressed at the FDA and the policy level, is more flexibility around entry criteria, patient criteria, and studies. The other area we identified as a big problem is patients being informed and given consent to be in studies. This is a process that has become, I would say, somewhat formalistic and legalistic, and that can be very off-putting to patients, particularly if you're going into a community of color where there's low trust levels already with researchers, because there's a lot of history there. So we think those are two areas where there are practical solutions that can improve participation in research. I think that helps all rare disease patients, no matter where they come from, but also means we can do a better job in the clinics taking care of our patients. So thank you very much.
And thank you all. And I will start with the government regulation, legislation, and policy, which that's the work group that I participated in, co-chaired, along with Julia Jenkins of the Everlight Foundation. This working group dedicated itself to examining the current regulatory interests, building on existing research and initiatives for rare disease patients, and identify where we can maximize legislative impact. We also advocated for more equitable government policy. We've outlined 3 recommendations that RDDC will pursue in the year ahead. Those recommendations are, first, increasing research and treatment innovations for minority rare disease populations by passing flagship signature legislation. We will focus on eliminating disparities in rare diseases, Access and Care Act, which is a piece of proposed legislation that will require increased funding and also for key government agencies to take action to benefit minorities with rare disease. The second recommendation, leveraging telehealth, which we heard from Dr. Summer, to better improve access to care and treatment for people of color living with rare disease. As we know, telehealth has played a major role in our lives over the last year, bringing physicians to their patients with ease and convenience, and that has inspired our next policy recommendation, educating the Biden administration, employees of the federal agencies, and bipartisan congressional leaders about the importance of addressing racial disparities in the rare disease community. And really aligning our leaders on these priorities will be crucial as we achieve action in the year ahead. In closing, in developing these recommendations, we've aimed high. We believe that the opportunity to make progress is real and within reach, particularly for groups of patients, advocates, and experts like the ones listening today. The list is not exhaustive. Rather, it will serve as a starting point for continued growing coalition impact. These recommendations are only the beginning of the RDDC work. In a few moments, Linda will share additional details on how you can join or engage with the coalition and drive these initiatives forward this year. The time to fight equity in healthcare is now. And I will turn it back to Leslie.
Thank you, everyone. I will now turn it over to Eric Dubé with Travere Therapeutics, the founding sponsor of the Rare Disease Diversity Coalition. Eric?
Thank you, Leslie. This has been such an exhilarating meeting, and I'm so grateful to have had the opportunity to learn from so many passionate leaders here today. And I'm truly inspired by Alonzo, Stacy, Elisa, and Kevin. And I want to thank you for honoring us with your personal stories. These are the stories and the perspectives that we need to keep front and center as we drive this work forward together in achieving health equity. Each of us has a story to tell, and each story holds tremendous power for change if shared with others. Collectively, our stories have the ability to achieve the change needed to reach and support families who have been underserved until now in rare disease. Today, we've heard the steering committee leaders share an ambitious roadmap to tackle this health inequity and racism in healthcare, including cultural sensitivity training for providers, clinical trial tools, resources to better engage and empower patients of color, proposed legislation to accelerate rare disease diagnosis and treatment in diverse populations. And that all leads me to this question. How can we work together to turn these plans into action and reality? Here are a few simple steps that you can do today, which is first to sign up on the RDDC website to get involved. Second, tell your story about rare disease and the barriers to accessing quality healthcare. This Sunday is Rare Disease Day with the call to wear stripes. The stripes in rare disease reflect the image of zebras. In medical school, doctors are taught that when you hear the sound of hooves, think horses, not zebras. And I believe that this type of training does a disservice for patients like myself affected by a rare disease and reflects a bias against the unique experience of patients who do not reflect the historical majority. And so I hope that you join me in sharing your stripes and your story. And through that, I believe you can also catalyze others to act. I was thrilled to hear from other leaders today, such as Juliet and Christian, talk about community. Our organization, like so many organizations in rare disease, lives by a value of community and that we are stronger together. We heard today about the isolation and search for help and answers. And I know that we will be stronger together as we move forward with these important initiatives. As a group, and for those who may join us in these efforts, we can accomplish far more when we come together with a common goal of health equity in rare disease. This journey in achieving equity in rare disease has not been easy, but a better future can and will be achieved with the combined knowledge, passion, and courage of those of you joining today and others who will join us along the journey. I am confident that a year from now, our work together will have already yielded tangible progress against racial and socioeconomic inequality that so many rare disease families face today. But this is a multi-year journey together. And we're proud and grateful to stand alongside every one of you on this call and share our hope that in the near future, diversity in rare disease will be reflected in everything that we do. Thank you so much for gathering today, and a special thank you to Linda and Tammy and the team at Black Women's Health Imperative for your incredible leadership and bringing us all together. Thank you so much.
Thank you, Eric. And let's give this program right over to close it out to Linda Goler-Blanc.
Well, thank you, Leslie, and thank you so much, Eric. I know I speak for the entire steering committee when I say we're grateful for your support, the support of Travere and our sponsors. And I just want to echo what Eric said. If you haven't done so already, I invite you to join the coalition. Go to rarediseasediversity.org and sign up, stay in the know, get the messages. But importantly, know that the RDDC meets, the full coalition meets every other month, and you're welcome to join. We'd love to hear your voice and to share information, share our progress, get ideas from you, have you on board with us. As Eric said, this is a long journey. So I just, again, want to thank you for your work, your commitment, your courage. I'm humbled and inspired to be on this journey with all of you, and so proud to be, to take Juliet's word, in community with all of you, because that's what it's going to take to get this done. Thank you very much for joining us today, and I look forward to working with you in the future. Leslie?
All right. Thank you so much, Linda. And of course, steering committee members, guests, all the people who participated today. It's been a true privilege to be with you, to moderate. And so don't forget to visit rarediseasediversity.org for more information and to stay involved. As Linda just mentioned, thank you. And I hope you have a great rest of your day.